Your doctor has recommended an HSG test. Now, what is that? And what do you do to prepare? A hysterosalpingogram, hystero, salpingo, S, gram, G, HSG, is a very typical fertility test to check anatomy. It's making sure that both fallopian tubes are open and that the inside of the uterus is nice and normal. And it is a very important test for fertility. Not everyone needs it, but you are going to read a lot of information about it online. And I want you to understand exactly what we're looking for, exactly what is going to happen, and make sure that you can ask your doctor questions about your experience to make sure it's a good experience for you. Welcome to the Baby or Bust Fertility Podcast. I'm your host, Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist who's been doing HSG tests for over 20 years. It's a valuable test, but it can definitely cause a lot of anxiety because people can feel cramps and sometimes pain with that fluid going through the fallopian tubes. But there's things that you can do to understand, prepare, and learn more to make sure that this test gets us valuable information for your care, but you have an okay experience as well. Let's get started. The HSG is one of the most common fertility tests. And if you are planning to do one as a part of your fertility journey, I want you to understand more about it. First of all, what is an HSG? An HSG is a hysterosalpingogram. Hystero stands for uterus, salpingo is fallopian tube, and gram is study. So we call it HSG just because it's easier to say. This is a common test done early in a fertility journey because part of understanding why someone might not be getting pregnant or thinking through treatment options is studying anatomy. And you can get really important information from an HSG that you can't get from any other study. The HSG is making sure those fallopian tubes are open, and it's making sure that the inside of the uterine cavity is okay. At its core, I've got my little stuffy Uni, I think we named her in our last video. The fluid is placed through the cervix and fills up the uterine cavity and then spills through the fallopian tubes. And this really is one of the best ways to make sure the fallopian tubes are open. People can have blocked fallopian tubes and have no symptoms. So having a period, which is basically a shedding of the lining of the uterus outside of the body, has nothing to do with fallopian tubes. So people have blocked fallopian tubes. They've had a tubal ligation, for contraception, and they'll still have menstrual periods. People can have blocked fallopian tubes and have no pain or any signs of it. So it's unlikely, but it's an important part of the fertility journey. Other ways to figure out if your fallopian tubes are blocked or not is doing laparoscopy. So you can actually look inside the belly with a procedure, and then you can flush fluid through the fallopian tubes and watch it through the camera that's inside the belly button. But that is, involving a surgery and the risks that apply to that. And so an HSG is much less invasive, quicker, and does not involve surgery. There are alternatives. There's something called a sonohysterogram, where a little tube can be placed into the cervix and then air bubbles and a little bit of saline can flow through the fallopian tubes. And you can look with ultrasound to see if the fallopian tubes are open or not. But this is not as reliable as the HSG. And that is why this study has been around for decades in the fertility field and is still used today. We do an HSG often at the beginning of a fertility journey, like I said, to make sure the anatomy is okay. Sometimes your doctor might order it after you've been treated for an ectopic pregnancy to kind of check on the health of the fallopian tube or tubes. And sometimes you'll do it along your fertility journey, but typically it's most often done in the beginning to check on anatomy. Now, the most common question that I get as a provider is, does it hurt? And when you're reading about this and you're looking up information, you're going to find a lot of information on the internet where people talk about how crampy and painful it was. And that can happen, but I want you to know the majority of people go through the HSG and they're well prepared, they're taken care of. It's a quick procedure. And afterwards they say it was not as bad as I thought it was going to be. So It's really normal to be nervous about this test, but I want you to have the education and prepare so that you know what to expect, because it really does give us such valuable information. You should know what to expect on the day of your HSG. So you should go over this with your team so you know what to expect. But in general, the HSG is usually done at a certain time in your menstrual cycle. It's typically done cycle day 5 through 10. The reason that we do it at this time in the cycle is for a couple of reasons. First of all, we want to do it before ovulation because people can still usually try to conceive in that same cycle. So we don't want to do it when there's an egg in the fallopian tube. We don't want to flush the egg out. We want to do it before you ovulate. Also, we want to do it after you've had heavy flow from your period, because one of the things that we're looking at with an HSG is the inside of the uterus, or the uterine lining. And so if you have a thick uterine lining, you're bleeding heavily, you're kind of at a heavy part of your period, it's hard for us to really see the inside of the uterine cavity very well. And you have a higher chance of getting kind of a false positive. It could look like, oh, maybe there's a polyp in the uterine cavity. Maybe there's something there. We should investigate further. But really, it's just a little bit of the lining of the uterus or a blood clot that just hasn't exited the body yet. And so that is why we time the HSG the way that we do. It's important that patients understand what to expect on that day, kind of understand who's going to be in the room there. What does the room look like? Because when you walk in, it could look like a procedure room. There's special equipment that allows us to use the fluoroscopy. There's a table with little footrests, and that's where you're going to sit. And so you'll decrease your anxiety. You'll be more prepared if you ask your team a little bit about what to expect that day. But imagine kind of coming into the procedure room, having a team there that is there to help you. Typically, it's at least one person operating the machinery and another person actually doing the procedure. But learn a little bit about what to expect so you can be prepared. Typically, walk into the procedure room, maybe changed into a gown. You'll be undressed from the waist down, so no underwear and no pants or skirt, kind of wrapped up in a sheet. Sit on the table, lie down, have your feet in little footrests, and then like a pelvic exam, a speculum will be placed into the vagina. The cervix and upper vagina are usually prepped with a betadine or a solution that will kind of clean the area. And then the little catheter or tube is placed through the cervix. And when everything's ready, the doctor or the medical provider will depress a syringe that has fluid, and it kind of pushes the fluid into the uterine cavity and then watches the dye come out of the fallopian tubes. And the whole time there'll be x-rays, little x-rays that'll show this happening in real time. If you're going to have cramping or feel discomfort, it's most likely going to happen as the fluid is going through the fallopian tubes. The fallopian tubes are so small and delicate and fine that they're not used to having fluid kind of go through them. And so that can often cause that cramping or discomfort. I will say that the majority of the time, people who have the most discomfort is if they honestly have a blocked fallopian tube, and the provider is just trying to make sure that they have a really good assessment of the anatomy. So the provider might be trying to push fluid through the tube to decide, okay, is this really a blocked fallopian tube, or is it just that I haven't built up enough pressure to make sure the fallopian tube is open or not? And so talk to your provider beforehand, talk to your team, learn about what to expect. When you arrive that day, share with the team, I'm nervous about this. Like, if it's too painful, what will we do? Will we stop the procedure? I think just having an honest and vulnerable conversation where you really kind of understand what to expect will really help you on this day. We're going to get back to learning more about the HSG test in just a second, but I want to remind you how important it is to support the show. Please take a moment and follow the show wherever you are listening right now, and another second just to give us a review. A 5-star review and a little bit about what you find valuable about the show is so important for helping other people find this resource to help them on their family building journey. So if you have found any value in the show so far, this could really help us, and I appreciate your taking a moment. Now let's get back to learning more about the HSG. Every clinic is a little bit different, but we often tell our patients to take pain medication before the procedure. So Motrin, ibuprofen, Advil, they're all the same medication and they're NSAIDs. NSAIDs actually block the production of prostaglandins, and prostaglandins are what make the uterus cramp. So if you take Motrin or ibuprofen about an hour before your procedure, it's going to be on board and help the procedure be more comfortable. You could still feel pressure and cramping as the fluid is going through the fallopian tubes. But if you have the Motrin on board, that cramping is going to resolve sooner and you're going to feel better for the rest of the day. What about complications from this procedure? Talk to your provider. This is not medical advice. You should really go over this with your team. One complication could be infection. And so it's not routine for every practice to give antibiotics before this procedure. But if you have had a history of pelvic infection, if you might be at risk of getting a pelvic infection, your doctor or medical provider might prescribe antibiotics to start before the procedure and even continue for a day or a few days after the procedure to decrease the chances of infection. Again, it's not standard for every patient to receive antibiotics, but talk to your team about if it might be right for you. Another complication could be bleeding after the procedure. It's common to have a little bit of spotting that might continue for a day or two. If you're concerned at all, call your provider and ask questions. A third complication could be an allergic reaction to the fluid or the contrast dye that's being used during the exam. So definitely talk to your team if you have had allergic reactions to contrast dye used before. So if you've had a CT scan before or other types of fluoroscopy where dye has been used and you had an allergic reaction, definitely talk to your team. So talk to your doctor and your medical team about other risks that might be involved, but these are the basics. After the procedure, things to look for, that you might want to call your doctor about is if you have a fever, if you have pain that is not being relieved by Motrin or it's ongoing, after the procedure, not just like cramps here and there, but pain, call your clinic. If you're having heavy bleeding or if the bleeding is really continuing for a few days, call your clinic. And any discharge that doesn't seem right to you, just anything that you're worried about, don't hesitate to call your clinic. All these complications and worries are very rare, but your team is there to help you. So just don't hesitate to call. So how to prepare for your HSG. So remember to call on the first day of your menstrual cycle so that you can get it scheduled. When you're scheduling, ask questions about parking and what to expect for that day, when you should check in. Don't want to be late for your procedure. If you're worried about pain, talk to your clinic about options. Should you take Motrin beforehand? Are there any other alternatives? Just ask questions. If you're worried about your anxiety on that day or being really nervous, talk to your team about that too. The more you can prepare and kind of think through and set your expectations, then the less anxiety provoking it's going to be for you. Make sure that you've got Motrin before that day. If you need to take it, make sure you've got it at home ready to take, and then think about the rest of your day after the procedure. A lot of times people go back to work. A lot of times people go on with their day after their procedure, feel just fine. But if you can, why don't you plan for a relaxing afternoon if at all possible? Most of the time people drive after the procedure, but if you're worried, you're anxious, find a ride, have somebody give you a ride home afterwards, and just plan for a relaxing day. Really pamper yourself. This is a big test. It's a big step in your journey. You don't know how you're going to react to it. And if you could possibly just make it a self-care day, more power to you. So other things to know. You will likely get preliminary results on the day of the procedure. So the person who's doing the procedure might be able to tell you, hey, I see that your fallopian tubes are open, or, oh, there's an area on the inside of your uterus that we want to take a little bit of a closer look at later. So typically people get preliminary results on that day. Now, the images will often be reviewed and discussed with your provider. And so things could be finalized or change a little bit as the final read comes forward in the next few days, but expect to maybe get a preliminary result. Something else you should know, there's a chance that we might not be able to complete the procedure that day. So there are times where it's just difficult to get into the cervical canal. It's hard to get the fluid where it needs to go. Sometimes people want us to stop the procedure. Just I hope this doesn't happen to you, but there are times where it might need to be rescheduled or completed on a different day for you. And so I just want you to be aware of that potential. Something else you should know is that sometimes people have a pretty emotional response or an aversion to this type of test, especially if there's a history of sexual trauma. So if you're nervous about it, please talk to your team about ways that you can make the space more comfortable. Can you bring AirPods and listen to music? Can you take a relaxing medication before the procedure? Just think through ways that could make this procedure best for you. Another thing to know is that radiation is used for this procedure. When you come in, don't be surprised if the people are doing the procedure are wearing lead aprons, kind of like when you get x-rays for dental procedures. The radiation is required for us to be able to see inside the body and make sure those fallopian tubes are open. And it's a very minimal exposure, and you can go on and try to conceive that month and over the next few months if you and your provider decide that that's right for you. Fun fact, there's actually some evidence that doing the HSG makes people more fertile in that same month and about 3 months following the procedure. So there's something about flushing the fallopian tubes, clearing out a little bit of mucus or something like that, that there's a lot of times when people are struggling to have their family, and that same month of the HSG or a month or two following, they get pregnant. So it's not used as a treatment for fertility, but this is a side benefit that some people have seen. One more thing is that the results might be wrong. What? Yes, I said that. No test is perfect. And there are times where the results from the HSG are wrong. Sometimes we might see what looks like a filling defect in the uterine cavity, like a polyp or something impacting implantation of the embryo. And then we go to do a hysteroscopy, which is actually taking a camera and looking inside, and nothing's there. Sometimes it looks like a fallopian tube is blocked, but we find out later, either at the time of a laparoscopy where we're watching fluid go through the tube, or someone repeats an HSG in the future for one reason or another. And actually we find out that that tube that we thought was blocked is actually open. So this is very rare, and most of the time the information that you get from this test is correct, but I just think it's important to know that no test is perfect, and just really talk about the results and how they impact your fertility journey with your provider. I hope you found today's episode valuable. If your doctor has recommended an HSG and you were not knowing what that meant or what to expect, I hope you have learned some valuable information today. You can get more educational content, more information at my website, drlorashahine.com. That's where all the episodes for this podcast live. Of course, other places too, like on my YouTube channel, on Apple Podcasts, on Spotify. But on my website, there's more information, links to the books that I've written, links to my blog. I really want to help provide educational content and people learn in different ways. Thank you to my incredible team at Audiotocracy for producing the show. This is the Baby or Bust Fertility Podcast. I'm your host, Dr. Lora Shahine, and until next week, wishing you love, luck, and pineapples.